everyone. Hope you're all doing good. Guys, welcome back to our OMR YouTube series. And this is all about the labor module. Of course, labor module, there could be structured discussions, there could be patient-simulated tasks. However, we wanted to bring out the most important case based on the newer guidelines. So I have Aisha here for joining as a role player. Hi, Aisha. Thank you so much.
Hello. Hi, Sowmya.
Yes. So this would be a 10 case thing where, 10 minutes station. So we are going to show you the station, and I'm just keeping the timer as well, just to keep it like the exam. Okay. Yes, guys. So Aisha, shall we start?
Yeah.
Miss Sarah White?
Yes.
Hello, I'm Dr. Sowmya, one of the doctors in the clinic today. So I understand that GP has referred you because of the tummy cramping and the pain. So as we are meeting for the first time, is it okay if I ask you a couple of questions before we proceed?
Yeah, that's fine, doctor. I'm just worried about my pain.
Okay. Sarah, please don't worry. If you have too much of pain, I can give you a pain relief. But if not, we could figure out why the pain is all about.
Yeah, it's tolerable. You can just go ahead.
Okay. Sarah, could you please tell me about this pain? When did it start and all that?
Yeah, I was perfectly fine, 2 days back. Yesterday night, I started with a little bit of cramps. I thought it might be something, because of some work I've done. So I went to my GP because it increased in the, intensity. So he said it's better for me to meet you and go ahead with the consultation.
Okay. And is this actually, how is your baby's moments, and have you named your baby?
Yeah, it's Jack, and the baby is doing fine. He's kicking all the time. That's not a worry, only the pain. Because, doctor, I had 2 previous cesarean section. I'm just worried because I should not end in cesarean section this time too. I'm just hoping I'll go in for normal vaginal delivery.
Okay, Sarah. Sarah, I would be quickly coming to your pregnancies as well. So what I understand, you have got this cramping, and this is your third pregnancy, and the previous 2 are cesarean, right?
Yes.
Yes. And just to understand whether this cramping is associated with any pain while peeing, or you have any tummy pain other than the cramping ones?
No. It's not associated with the pain or bleeding. Nothing else. I'm just a friend.
Okay, thank you so much. And how has the pregnancy been so far?
The pregnancy was okay, and we've enjoyed, and the baby is fine. All the tests and scans which were done till now were all normal. So I'm just hoping, when everything is normal, why not normal delivery?
Okay, I'll come back to that to tell you about that, and to discuss, I need to know about your previous pregnancies. So what I understand, the 2 previous pregnancies were by cesarean section. Could you please take me through about those 2 pregnancies? Like why cesarean was done and how it all went?
Yeah, for cesarean, the test, the scans were all normal. The baby was also good. The journey was smooth. Pregnancy journey was smooth. But it was bottom first, the head was up. So they said it could be a risky one to have a normal vaginal delivery. So that was the first pregnancy. So we were all worried and we agreed for cesarean section. And after delivery, everything was okay. Baby Sarah was also good. Okay. And the second pregnancy I conceived after 2 years of my first cesarean section. But it was also smooth. But at the end, where I just wanted normal delivery, and that too I wanted home delivery. But my midwife said it was a bit scary to have home delivery. And then I agreed upon for hospital. But as I went, I experienced pain, and they told me my scar had ruptured. So they had to do a cesarean section on an emergency basis. Yeah, so that was a bit scary one. Yeah, so I'm a bit anxious about that too.
Okay, Sarah, I can see you have gone through a lot in the last pregnancy. I'm happy that the child is fine now. All the kids have been fine. And I'm glad that it was taken care well. And I completely can see where your anxiety is coming from. Not to worry, we shall discuss what's the best way out for you. Okay. And yes, how otherwise generally are you fit and fine?
Yeah, I'm fit and fine. There's no issue with that.
Okay. Are you allergic to any medicine?
Not that I know.
Okay. And I need to ask you a couple of questions which we ask for all the women who come to us. So do you smoke?
I used to, but during pregnancy, I have totally stopped it.
Okay, that's fantastic. And do you drink?
Occasionally,
Okay. Any drugs?
no.
Okay. And apart from this, how is your support at home?
Yeah, my partner is very supportive.
Okay. And are you aware of your blood group?
Yeah, it's O positive.
And by any chance, if you need blood to be given, are you okay for that?
Yeah, that's okay with me.
Okay. Sarah, thank you so much for giving me all the information. For quickly summarizing, because we have discussed so far, this is your third pregnancy and you are into your 36 weeks. And the first two deliveries were by cesarean section. The second one was complicated by scar giving away. And right now, you're well supported and the blood group is O positive. You do not have any other concern. Right now, your intention of visit was to for the pain, and also you are intending to have a normal delivery. Am I right?
That's right.
Yeah. Is there anything else if you want to add on?
Nothing.
Okay. Sarah, first of all, for this cramping pain, I need to have a look whether this is anything related to labor. So we will have a quick examination to understand that. And also I would be checking your baby's heart rate as well to make sure that the jack is fine. And apart from that, if you're not in labor, if you're not going into labor, we need to do probably a urine test to see, if at all, if you have any urine infection, which is causing this cramping. So sometimes the cramping could be unrelated to all of this, but because this is a third pregnancy, you had two previous cesarean sections, so we need to be careful on that. And if we do not find any reason for this cramping, generally we advise that you to come back in the next week to think of the further plan and to understand that you wanted to have a normal delivery. The thing is, what the majority of the women in your place will have is to definitely come to the hospital to have a delivery because you know that there is a specialist team like my consultant and the baby's doctor. I hope you're fine with that, right?
Yeah, I'm fine. Yeah.
Okay. And the for the women who have had a previous car giving away, the normal delivery could be little risky. The main reason being the scar can give away anytime once again, which could put you and the baby at the risk. So, what are your
Yeah, that this is what I had experienced last time. But doctor, I'm still hoping. Okay, will that repeat or will I have normal vaginal delivery?
Yeah, see, the thing is definitely I can see your wish of having a normal delivery. But since the scar had given away last time, that means to say that the scar wasn't strong enough to hold the pregnancy. So that means to say that during the stress of the labor, the scar can still give away. Generally, we say that 1 in 200 women this can happen. But if it had happened previously, then the risk becomes much more. And that's the reason we would want you to, you do know that pushing to an emergency last minute could be really difficult. So that's the reason.
Yeah, what I wanted to know is when I had some rupture last time, the doctors would have stitched it very strongly, isn't it?
Yes, of course, that is the case whenever we always try doing the best, but the problem is the healing of each person is very different. And also, it is not only that the stress of the labor, we cannot tell how much the scar can hold on to. Definitely, we can measure the scar thickness and give an idea, but however, it is always safe for you to go for a repeat cesarean section. The reason being to prevent you from having another scar rupture. However, I would put you in touch with my consultant as well to have a discussion once.
Okay.
Yes.
Okay.
And also, I would also want to tell you that yeah, I forgot to ask you, like, are you intending to have a big family as well for,
Yeah. I'm hoping for a big family because my parents they had a lot of children, and it's always like nice, house full of children.
Okay, so what does that mean is, so then repeat cesarean section would be actually the probably one of the things which could save you from all these problems, because what happens if the scar gives away, then there could be a risk of bleeding followed by procedures which are unexpected. And definitely for repeat cesarean section also there are a couple of risks, like probably there could be problem in taking out the baby, and there is even though we are very careful, sometimes there could be a risk of having injury to the bowel and the bladder. Of course, those risk, if at all, if it happens, we as a team, we will be ready to manage that as well. Okay. And ideally, so the timing of the delivery should be, if at all, if you go early in labor, we need to be doing the cesarean section at that time. If not, we can decide with you and my consultant, so that probably we could do around 38 weeks as well, the repeat cesarean section. 38 to 9 weeks. Okay. And yeah, make sure that once you go back home, of course, we will do the test. And if everything comes well, you need to make sure that you have an eye on the movements of the jack. And if this pain repeats or recurs, or if you have a bleeding or anything, you need to come back. And of course, I'll provide you with information leaflets and the GP letter as well. Okay, Aisha, we are done with the time. Okay. So, yes. So how was it according to you? Because this was a very vague station and, like, very, yeah.
Tricky. The thing is, she will keep on insisting you, the role player, that she wants to have a normal delivery. The how you convince her and how you put across the words used, only that matters. What I feel in this station, yeah. Telling her about the risk and the pros and cons of normal vaginal delivery, and the risk associated with it, and how cesarean section will be helpful for her, is the one keynote in the station.
Okay, so I think I did justice. I'm not sure because I thought generally I do finish on time. In a moment, I lost somewhere actually thinking of probably I wanted to talk about the future pregnancies and talking about contraception. But I know that at this point of time, probably that wasn't called for. So that is where I was stuck actually, to be very honest. So that's why I was like 30 seconds, I was like, what to do? So probably that we could overcome. And of course, here the feedback is an out of choice because of the previous cesarean section. Two previous CSS for self itself increases the risk, and previous cardiac so 100% that could be very difficult. So guys, coming back to the scoring system.
One point I want to put here is that when the role player insists on normal vaginal delivery, if a candidate says, I agree with you or I respect your wishes, and then goes in favor for that, then that station would go in the wrong way.
Yes, yes. Then there is no getting up from that station. Agreed.
Yeah, yeah.
Yes. Guys, for the I've just given a competency of competent candidates and a non-competent candidate, just to give an overview. History taking, of course, we didn't go in a very traditional way. I wanted to make sure that you guys should know how to go into conversational mode rather than telling me, is this first pregnancy, is this second pregnancy? I didn't want to go it in that mode. That's why I went into a very different thing about asking open-ended questions. And that's how I got most of the things. And VBAC versus cesarean section, yes, I touched upon talking about this. And active management of cramps at 36 weeks. Of course, I did say that I examine, if not in labor, what we are going to do, and the UTI and other reasons to be ruled out. Contraception counseling, as I mentioned, like probably we didn't move there, but yes, you could say that like after your pregnancy, after this, because I could have added a word, because you're looking for more babies, probably after this pregnancy, after this delivery, we will be talking about the options as well. And empathy and communication, of course, make sure that you are non-judgmental with this, because that's what is very, very important. As a role player, she would be asking about all possible things, and she's more worried about this one. Of course, you need not talk about counselor and therapy and all unless she tells that she's getting flashes and all that. Okay. So, and of course, don't forget the consultant part of it. Okay. Thank you guys. Hope this is useful. Make sure to subscribe our channel and go through these series, because we are making it very light and conversational, and understand what the common mistakes which you can do as well. So I think that would help you to do better in the exams. Thank you guys.